Nairobi Women's Hospital opened its doors on the 5th of March, the year 2001. So it's now slightly past 10 years. I must admit it's been a long journey. We started with one branch in Hurlingham, and subsequently in 2009 opened our second branch at Adams Arcade. And just 2 months ago, we opened our third branch in Ongata Rongai.
It's a fairly large facility. It has 77 beds. It has both outpatient, a wide range of clinics in outpatient. It also has inpatient services. It has a conditioned state-of-the-art theatre with new equipment. It has radiology, that's the medical imaging department. We also have a laboratory for diagnostics, and also we have a pharmacy.
The Hurlingham branch has very skilled and experienced staff that deal with mainly, of course, women health issues. That's very unique because we have a lot of patients that come through our doors, and our doctors and nurses are trained and of course experienced to handle these particular kind of cases and give care above which can be expected anywhere else.
The Gender Violence Recovery Center of the Nairobi Women's Hospital was it came to being in March 2001 in response to a need that was felt at the community level. We had women who had been battered, we had women who were going through sexual violence, and they didn't have a place to seek support from. And so the center was created in response to that felt need. And to date, we have been able to support over 19,000 survivors of gender-based violence.
Our vision is very clear. We certainly want to touch at any given time. I mean, if we look at our purpose is that every woman who is actually looking for a place to really be cared for, to have a child safely, to have their children looked after safely, to have their needs looked after, we want to be the first point of call.
When somebody gets admitted to Nairobi Women's Hospital, they should have the comfort to know that in the unfortunate event that their patient got worse and needed ICU services, they need that comfort that they can get a bed.
The whole idea from a strategic point of view is to make sure we are accessible, and we're making sure that we are going where we know women currently do not have the service available. That actually is going to be our unique proposition from the expansion strategy that we're taking, that we're rolling out at the moment.
One of the things that we realize is that there's a huge shortage of healthcare workers, not only in this country but also in the region. And the capacity of the existing medical training colleges is limited. So you find that there's a shortage on one end of healthcare workers, and yet there's enough supply of our young adults who are coming out of Form 4 who are qualified to join colleges, who would easily train in these colleges if they were available. So in the Nairobi Women's Hospital group, we added a new institution, the Nairobi Women's Hospital Medical Training College, initially going to be based in Ongata Rongai branch, and they're also going to be practicing within our other branches as well. And we have the vision that in another 5 to 10 years, we should be the private sector leader in training healthcare workers in this region. One of the other responsibilities that we've taken upon ourselves as Nairobi Women's Hospital, of course this is also a requirement, is that the disposal of medical waste in this country has not been handled very well in the past. And working with the GIZ, we've invested more than 30 million Kenya shillings. Again, to the best of my knowledge, we have the largest and the most modern medical waste incinerator in this region that is smoke-free. And we did a deliberate over-investment in terms of capacity, so that then we can help the small and medium hospitals, especially within Nairobi, to be able to incinerate their waste.
We've undertaken a huge strategic piece of work and what we call an engagement piece of work with every single member of staff. And this is going to be continuous. And in doing this, what we've done is we spent now the last 4 months actually calling in all the staff. First of all, we developed really what is our purpose as an organization, making sure that every single member of staff buys into that purpose, understands who we are and what we stand for, and then making sure that we keep that alive from programs that we're going to continue to run, so that everybody who comes to work for Nairobi Women's Hospital does not see this as a job. Yeah, they see it as a vocation. So that is something we're trying to ingrain and build as we go on, and it's not going to take a day. It is a program that we have put in place for every single member of staff going forward now.
We've chosen a vision and mission that people can live every day and they can remember with their hearts. This is something that we live every day, and we would like the public to hold us to account.